Hi, my name is Zev Gershon. I'm a physician and an attorney, and I practice medical malpractice, specifically concentrating in cerebral palsy cases. Today I'd like to talk about nucleated red blood cells. Nucleated red blood cells are precursors to red blood cells. What do I mean by that? Specifically during labor and delivery, when there can be a lack of oxygen or blood flow to a baby's brain, the body will call up some extra red blood cells to help carry as much oxygen as it can. These precursor red blood cells are called nucleated red blood cells. And one can measure, if you will, the amount of or timing of an insult during labor and delivery with using nucleated red blood cells as a general aid. What do I mean by that? After labor and delivery is done and the baby's delivered, if one thinks that there is a hypoxic ischemic encephalopathic insult that occurred during labor and delivery, that is lack of oxygen, lack of blood flow, check the nucleated red blood cells after birth. What one usually sees is a rise, an increase in nucleated red blood cells, because a normal fetus does not have any nucleated red blood cells. So for example, if there's a small amount of nucleated red blood cells at birth, one can tell that during labor and delivery there may have been a hypoxic insult that caused the body to say, hey, red blood cells, we need some more of you to help carry the load, if you will. That nucleated red blood cells may continue to rise after birth, or may have a short rise, a slow rise, and then disappear. Either way, the exact mechanism or timing of them relating to when the insult occurred is not so clear. What's more important is the presence or absence of nucleated red blood cells. If your fetus or baby has suffered from a hypoxic ischemic insult during labor and delivery, the presence of nucleated red blood cells after birth would be confirmatory of that. In addition, many times the placenta, which is the unit that the baby nourishes through the mom, if you will, that can have nucleated red blood cells as well, found under a microscope. And that can also give folks a hint, if you will, that the baby suffered from lack of oxygen or lack of blood flow during labor and delivery.